Hi, this is Glen Macnow of WIP Radio. Delighted to be here today with Dr. John Lamond, Medical Director of Philadelphia CyberKnife. So, Doctor, let's start with this. People are surviving longer with cancer these days. Why is that?
Well, Glenn, I think the whole idea and philosophy in cancer medicine is really going through a dramatic change right now. It used to be that there was a war, a battle between the cancer and the patient many times, and we would give the patient very toxic sort of treatments. And the patient, if they survived, then we'd find out whether or not they were cured of the cancer. But these days, we're thinking of treating cancer more like we treat diabetes or heart disease. And quality of life becomes very important. So we want these patients, even the ones that are not cured, we want to give them the opportunity to live with their cancer now for months and hopefully years to come.
Doctor, specifically so that a layman can understand, how have chemo drugs improved and what is the impact of that on patients?
Well, chemotherapy drugs used to be very toxic, and even the toxicity of surgery and radiation therapy was there, and everything's been really refined. And the idea with chemotherapy drugs now is to target very specifically the cancer and minimize the side effects, the collateral side effects to the patient.
Dr. Lamond, how is the process of receiving chemo easier than it used to be years ago?
Well, one thing, there are pills many times instead of intravenous drugs to give. In other ways, instead of giving regular chemotherapy, patients are getting antibodies or small chemicals, again, that are targeting specific areas of the body to minimize the side effects. So both allow the patient to continue to live their lives with a higher quality of life than they did with the older forms of chemotherapy.
Doctor, could you expand on something you said a little earlier? Patients are not 100% cured of their cancer, but they learn to live with it like a chronic disease, like heart disease or diabetes.
I think so. I think really we're getting to the point where we're seeing patients live for many years with cancers and that was not the case, I would say, 10 or 20 years ago. So things have changed. Patients are coming up with different sort of problems, and many times they have to be dealt with local treatment like CyberKnife.
Dr. Lamond, if there's an analogy that you can explain it to people, what would that be?
Well, if the analogy is war, we fight wars with not just the Army or the Navy or the Air Force, but all three. And we're far more effective if we use multiple types of means to treat cancer. And radiation therapy is more like the Air Force, so we're focused on a certain area. And just like bombs have changed, and it used to be that we would carpet bomb an area and have a lot of innocent civilians die and there's now smart bombs. In many ways, CyberKnife is more like a smart bomb. It's very focused to minimize the collateral damage to the patient, minimize the side effects, still maximize the benefits by focusing in on a small cancer and having the highest chance of killing off that cancer.
So, Doctor, you've got that great model right next to you. It's the CyberKnife model. Explain to people exactly how that works.
Well, the CyberKnife is simply mostly here a robot, and on the robotic arm is a small radiation machine. But it can be pointed from any different angle or direction at the patient, but it can be pointed very precisely in targeting a small area in the body. Even if the cancer target is moving, the machine can move with the target.
Doctor, let's talk about how the CyberKnife differs from other forms of cancer treatment. Specifically, when the patient is going through it, what would be the difference for the patient?
Well, number one, and most importantly, it's non-invasive. So patients could come in, get their treatment, and leave, and it's very unlikely that they're going to experience any side effects that way. So the quality of life for the patient undergoing this treatment is high. Secondly, with it being non-invasive, it's also very precise. So we're targeting a very small target in the body. So those things are unique. The third thing is that with this robotic arm, we're able to aim at a moving target. So as the target's moving, sometimes it doesn't move, for instance, within the brain, but most of our targets move in the body. And that's what's unique about this machine.
And Doctor, what would be the difference from CyberKnife from, again, other conventional treatments in terms of recovery time?
Well, it depends what you're comparing to, I guess. But if it's being used in comparison to surgery, obviously there's a major change. There are other patients that receive up to 8 or 9 weeks of radiation, for instance, for prostate cancer, that only need 5 treatments with this machine. So there can be some major changes in terms of how the patient tolerates the treatment and the length of treatment.
Dr. Lamond, why don't more hospitals have CyberKnife right now?
Well, when we got Philly CyberKnife, we were the 25th CyberKnife in the world back in 2006. So things have changed. There are more and more CyberKnives, and the indications have improved. But still, you need a pretty large area, a number of people around to really, it's still unique enough that it's not for every type of cancer. We've treated over 2,500 patients, so we have a great deal of experience, and that's important. And as things increase in terms of the indications for CyberKnife, I think we will continue to see more CyberKnives around, but it's not for every single form of cancer.
So, doctor, tell us, what should patients who are dealing with cancer consider discussing with their doctors?
Well, it depends on the circumstance, and I'm hoping as more and more doctors are aware of the different sort of options for patients, that they would call us. The doctors could call us and ask us for our opinion. We're always available. Dr. Lanciano and I are always available. And for the doctors to call if they have a question or patients have a question. We don't want to waste anybody's time, but if they can call, we can at least direct them whether or not it would be suitable for them to see us.
Thank you so much, Dr. Lamond. That's Dr. John Lamond, Medical Director of Philly CyberKnife. For more information, go to phillycyberknife.com.